name is Maria Diaz, and my presentation is about asthma and childhood exposure of bioaerosols. What are bioaerosols? Bioaerosols can be formed from nearly any process that involves biological materials and generates enough energy to separate small particles from the larger substances such as wind, water, air, or mechanical movement. Plants, soil, water, and animals all serve as sources of bioaerosols and are subsequently present in most places where any of these sources live. Respiratory symptoms and lung function impairments are the most widely studied and probably among the most important bioaerosol associated health effects. What is asthma? Asthma is a chronic lung disease that inflames and narrows the airways. The airways are tubes that carry air into and out of our lungs. People who have asthma have inflamed airways. The inflammation makes the airways swollen and very sensitive. The airways tend to react strongly to certain inhaled substances. When the airways react, the muscles around them tighten. This narrows the airways, causing less air to flow into the lungs. The swelling also can worsen, making the airways even narrower. Cells in the airways might make more mucus than usual. Mucus is a sticky, thick liquid that can further narrow the airways. Asthma affects people of all ages, but it most often starts during childhood. Asthma has no cure. Even when you feel fine, you still have this disease and can flare up at any time. Young children who often wheeze and have respiratory infections, as well as certain other risk factors, are at highest risk of developing asthma that continues beyond 6 years of age. Symptoms of disease. Recurrent periods of wheezing. Wheezing is a whistling or squeaky sound that occurs when you breathe. Coughing. Coughing from asthma is often worse at night or early in the morning, making it harder to sleep. Chest tightness. This may feel like something is squeezing or sitting on your chest. Shortness of breath. Can't catch breath or feel out of breath. Many things can trigger or worsen asthma symptoms. Going to a doctor will help you find out which things may cause your asthma to flare up if you come in contact with them. Triggers can include allergens from dust mites, animal fur, cockroaches, mold, and pollens from trees, grasses, and flowers. Irritants such as cigarette smoke, air pollution, chemicals or dust in the workplace, compounds in home decor, and sprays. Medicines such as aspirin or other non-steroid anti-inflammatory drugs and non-selective beta blockers. Sulfites in foods and drinks. Viral upper respiratory infections such as cold, physical activity including exercise. Exposure. Exposure can be done by many factors: agriculture and related industries, biotechnology industries, food and animal industries, biopesticide industries, contact with some airborne allergens, or exposed to some viral infections in infancy or in early childhood when the immune system is developing. Family history of asthma, exposure to pets at an early age. Current issues. Increase of new industrial activities have emerged that expose more bioaerosols, increase of infectious and respiratory diseases, widespread use of antibiotics in livestock, children not getting proper treatment for asthma. How to prevent exposure to asthma. You can prevent asthma. However, you can take steps to control the disease and prevent its symptoms. For example, learn about your asthma and ways to control it. Follow your written asthma action plan. Use medicines as your doctor prescribes. Identify and try to avoid things that make your asthma worse. Keep track of your asthma symptoms and levels of control. Get regular checkups for your asthma. Preventing exposures to bioaerosols is difficult because we come in contact with them every day. Some tips that could help is to limit outside activity when air pollution is high. Decrease contact with any object that can expose any pollen, mold, or pesticides.